coming over here, and we're very honored to have you here. And I'm extremely grateful and honored to have a couple of top global shoulder specialist surgeons here. Dr. Stefan Greener from Germany and Dr. Stefano Gumina from Italy, from Rome. So what we are doing here today, we have a meeting called CULTCON meeting. So it stands for Chennai Upper Limb Unit Teaching Convention. So this featuring expert talks, panel discussion and live demonstrations with our international faculty and over 25 national faculty, my colleagues from all over India. And the aim of this conference, as you have seen here down, we are attended by 400 orthopedic surgeons all over from India, from Kashmir to Kanyakumari. The focus is on complex upper limb trauma. I am passionate about upper limb, which we are specializing in shoulder, elbow, wrist, hand. These problems are often missed or neglected. So, and they mostly treated by general orthopedic surgeon as well, and they have lacunae of knowledge to understand the problem. So our aim is to give this subspecialized training to general orthopedic surgeons and trainees. That is the purpose of this CULTCON. In this conference, we are also launching revolutionary technology for shoulder replacement. You all would have heard about hip replacement, knee replacement, everybody knows. But comes to shoulder, not many people, even doctors, don't know that shoulders can be successfully replaced and you could lead a perfectly healthy joint which is fully mobile. The shoulder is a special joint. It moves in three direction in 360 degree range. So, and it is useful for your day-to-day life, leisure, sports, etc. When it is affected by trauma, injuries or arthritis, the patient experiences pain and stiffness and unable to even eat or lift or day-to-day use. So in early stages, we try to repair the torn muscles, a torn ligament or broken fragments of bone. But in advanced cases, when everything else fails, we have to resort to shoulder replacement. Conventionally, we do shoulder replacement in a sort of eyeball manner, but nowadays the technology is helping us to do that very, very accurate. The two technologies we are talking about, number one is the VIP shoulder, which is basically, we had a set of prostheses to do the shoulder replacement, but now we have a lot of choices to suit each patient's unique anatomy. Can you show the model, the scapula? See, for example, in our Chennai upper limb unit, we get to see the patients with arthritis, and these days, rather than just X-rays and CT, we get a 3D print of the scapular bones. Patient's own scapula. You see the shape, size, arthritic, bone loss here. So how to address this? So the technology help us. Now, we can do a preoperative plan and we can choose the correct size implant for the patient's shoulder and fix it successfully. This is one technology. Second is mixed reality navigation. These words look like buzzing words for you, but this is what we do. Can you show that? Just open the HoloLens. So we use the HoloLens technology. Number one, this is like a mini computer which I wear during a surgery, wear like this, and I can just see the patient's anatomy superimposed while I am operating. And if I want to move it, I can move it like that, but I can put it like this. Now I can see the preoperative plan. We plan that and we put it here in the HoloLens, and that technology, hologram, will be projected onto the patient. Guided by that, we can do. We have done this operation successfully in last year. We have done about 10 to 15 cases in Chennai upper limb unit. It's something we want to demonstrate to the other orthopedic surgeons here. Now, thing to talk about is also a couple of services. Number one, we would like to roll an observership program for any orthopedic surgeons or trainees who want to learn shoulder upper limb surgery. That will be rolled in the near future. And second, we also would like to launch a public help service, a 24-hour helpline to talk about their shoulder, elbow, wrist, hand problem, seek advice, second opinion, etc. So these are the few things which we want to talk about. Okay. So anything else you want to ask?
So only you are doing this shoulder replacement, or Any other hospitals in India?
It is picking up. See, because I have been doing shoulder replacement because I spent my orthopedic education in India. Then I went to UK. I'm a UK trained shoulder upper limb surgeon, exclusively operating like 1,000 cases a year. We do about 150 shoulder replacement in UK. For example, Italy, Germany, the very developed shoulder replacement is regular list for them, and we have done like that. But in India, I came to India 2011. I did the first reverse shoulder arthroplasty with just ordering equipment from UK. I did that in 2011, and then I did the first stemless shoulder also in 2004 or 5. So I've been doing, I do a high volume shoulder replacement number, but it is picking up. Other hospitals also have started to do, but you should remember, shoulder is a complex joint, not like a hip. Hip is a big joint, knee is a big joint. You can do one surgery, you can revise, all sort of things you can do, but here you have to get it right the first time. The reason why the morning we talk about shoulder fracture, hall is packed, jam packed at 8 o'clock in the morning. Orthopedic surgeons are there watching what to do. Because you do expect problems with this shoulder fracture or shoulder replacement. That is why this experience in training is a matter. That is number one. Number two, now I am passionate about the latest technology being utilized for medical field. You see, AI is being used everywhere. Artificial intelligence. Now we have, if you put our patient CT scan in the system, we have the system to tell where to put the base plate, which is the plate to go here. That is a virtual implant positioning. Before going to operating theater, I can tell you what sort of glenoid you have, what sort of socket, what sort of replacement we are planning. We can tell the company what sort of things we need, and we can also show to the patient. And the second thing is the mixed reality. See, mixed reality is widely used in other sectors, but not in medical sector. In medical sector, we use this. I can display images of the patient, CT scan, MRI scan, everywhere in the theater inside, but I can see. Also, I can see the reality. This is the previous era. Now we are developing one technique where we can do take reference point first, plan everything. That hologram will be projected onto the real patient. Patient will be open like this. We can project this hologram image onto the shoulder. So this technology will improve our accuracy of shoulder replacement, so that the replacement will last for lifetime. If I want to do a shoulder replacement for a patient, it should be one operation for their life.
Is it the technology developed by you or?
No, the technology are being developed all over the world with different people. Okay, so the many other companies also doing it, but we are utilizing the technology to suit our patients. But this using the HoloLens to actually do MR mixed reality navigation, this is the first time used in India. This operation I did in May 2023, last year. We have done about 10 to 12 cases with that, but we are waiting to report that. And the results have been good. The advantage is that if you fix that artificial component into the shoulder in a very precise position, this is only glenoid is like that. If you are very sure to fix that properly, you can even let the patient move the arm the next day. Patient do not need to wear any sling. They can mobilize the arm like that. In 1-2 months time, they can be able to lift like that. So this is not imaginable when you do some anticipated steps and you are expecting the patient to wait for the recovery to start.
Is it affordable for the patient from conventional?
Of course. See, when you say 10 years ago when you had a knee replacement, it was very huge price, etc. But now everybody knows about knee replacement. Same way, now shoulder replacement is new. And second, it's not new. I have been doing for 20 years, but it is new for India, for the public, for the doctors. And it is expensive because knee components are simple components. But shoulder components, we have multiple components to click on to suit for the patient's requirement. So it is expensive at the moment. The prosthesis cost at the moment is around 2 lakhs. So that is something, a factor. It might be expected to go down, and more people are doing.
Is it covered with the insurance?
Yes, absolutely. All major insurance will cover it.
What is the success rate?
That's what the success rate, I would say to tell my patient, over 95% success rate of getting you full movement. Of course, when a major surgery is like this, always there is a complication rate of 0 to 5%, but we want to minimize that even to 0 to 1%.
So as you said, components are imported from foreign countries?
Yes, at the moment, yes.
As you said, this is a one-time solution for the.
For a end stage shoulder problem. See, for example, shoulder can be broken. If the ball is broken, we offer fixation. Basically, put it back, fix it, so that the ball to heal. If the rotator cuff, there is the 4 muscles in the shoulder that rotate the shoulder around. If they are torn, we repair it. I do that. A keyhole surgery called arthroscopy. We go inside, put stitches, put anchors, repair it. So let the patient move. So that is preserving own rotator cuff muscle. Third common problem is the dislocation. Young patients, sport injury, they dislocate the shoulder. It slips. It's very common. You would have heard about it. People will repeatedly dislocating. If it once time dislocated, it keeps on dislocating. In that case scenario, we'll do keyhole surgery to address the problem. Torn ligament or bone loss in the socket. Like this patient had a dislocating shoulder. But nothing was done. She was neglected. So now it's gone completely out. So now we had to do shoulder replacement. So the third thing is the arthritis. With age, arthritis will set in. We see why the shoulder replacement is done in large numbers in Europe countries, because I have practiced in United Kingdom as an exclusive shoulder upper limb surgeon for 10 years. And then I moved to India. So I know the system there. People live longer and independently in Europe, and after 80 years or so, they have painful shoulder. They come to attention because their insurance and healthcare are all covered by the NHS. So there is nothing to worry about it. And if they don't operate on the shoulder, if they lose mobility, they'll become dependent. So they don't want to do that. So the patient will come volunteer for replacement. So they just keep going. But here in our society, I will see like 75-year-old lady with the arthritis, but they will say, oh, big operation, no. They will go for consultation with 2-3 doctors. You know how people consult outside. Not only expert, they consult everyone. Okay, I mean everyone. Okay, the most of the people will say, oh no, I've not heard about it, so no, I don't think it's good. So they get discouraged. So they don't come forward for shoulder replacement much. I think that's the same in, want to say something about the extent of shoulder replacement in Europe.
Limit, sir?
Sorry?
Any age limit?
No age limit, but the shoulder replacement is usually done for older age group. The arthritis in the shoulder, you people get arthritis in the knee very quickly, 50s, 60s and all, but shoulder arthritis hits only when it is 70 plus. I want to say a few words about the shoulder replacement in Europe.
Yeah, I think so. We have a long history of shoulder replacement, but I still can remember that in the beginnings you have all the GPs who are a little bit hesitant, because as everywhere they started with like these disastrous fractures and we had just hemiarthroplasty,
Yes.
which was not the best solution, and then they had these patients which not so good function, so everybody was saying, oh, shoulder replacement, you shouldn't do that. But now, since we are very, very successful, we have many patients coming and asking for shoulder replacement, even if it's not like now indicated, and you just have to convince them. Now we still have other solutions, but at the moment it's a very successful operation and the numbers are still growing. And although everybody was talking about the huge amount of revision surgery which will come from the numbers we implanted, so far we didn't see them actually. So I can just confirm, once it plays properly, it's a really long-standing surgery.
What to say?
Of the indication at the present for a shoulder prosthesis is incredible, because we started with the arthritis, but now we implant shoulder prosthesis in many occasions in patients with fractures, with massive rotator cuff tear and a very bad range of motion in patients with tumors. And
Also.
In Europe, we have a very important experience, because you know that the shoulder prosthesis, and in particular the reverse shoulder prosthesis, was permitted in the United States in 2003. And before, the implant was forbidden for the United States. But when they observed our results in terms of function, in terms of daily activity, they increased the implants of this shoulder prosthesis. I would like to add an idea that I formulated this morning, because my dear friend Ram said that technology, said that these instruments that we have now for implanting the prosthesis are increased our knowledge and have increased our experience, but is fundamental the experience of the surgeon. And I think that in your country, the experience of your surgeons is a very, very high. And today, this morning, during the first two sessions of this Congress, I experienced this idea, and I was not surprised about your high level of knowledge in this field of surgery. That is a new field of orthopedic surgery.
Thank you, Stefano. We are humble. Yes, any more questions?
Sir, in India, we don't have awareness for shoulder replacement. Do you have any idea of conducting campaign or medical campaign?
Sorry, I didn't get that.
In India, we don't have awareness for.
Oh, yes. We are.
Any idea of conducting campaign?
Yeah, we are doing our best. Number one, I was the president of Shoulder Elbow Society of India, which is actually the orthopedic surgeons who want to specialize or want to more training on shoulder, elbow. They joined the group, and I was the president for 4 years, from 2017 to 2021. And I have traveled all across India to conduct meetings like this to the orthopedic surgeons, medical colleges, private hospitals, talking about shoulder replacement to first orthopedic doctors. And now second, we have to reach to the general doctors, because often you get to see orthopedic surgeon, you get opinion, you want to get a second opinion from your home family doctor, but they should be also encouraged. So if we are doing that through Indian Medical Association and local regional meetings. And third is the public perception. That is much more important. If I operate like 50 shoulder replacement in a year, I see 200 patients, they require operation, but they don't come back because two things. Number one, cost, expensive, that's one thing. But most important thing I think is that they get for some second opinion from their neighbors, housemates, all these, they get opinion in our country. So they get, and that person will tell something like that. So that's a problem. So that is why we are launching a 24-hour helpline from Chennai upper limb unit base. You just ring the phone, you'll have options to choose, and including like appointment or second opinion. You want to send your data, etc. You want a free second opinion, you can get it. And you can want to speak about your problem. That is much more important. We will have our physician assistant to take the call and say, shoulder, elbow, wrist, hand. We're talking about shoulder, but I also operate in the wrist and hand surgery. That is also another neglected area. So if we can discuss about the problem, you will get some way of solution. That is also we are launching today evening.
Replacement,
Yes?
replacement, and how many years? 15 years you told me.
Oh.
After that you have to replace it.
No, I didn't say 15 years. I said I am doing shoulder replacement for 15 years. No, the long-term results are from Europe. I think is for primary arthroplasty, reverse shoulder, the 20-year survival. We say survival means the prosthesis survival is over 95% for arthritis. Sorry, you want to take that?
No, I'm just
long-term survival.
I just wanted to add something because I think shoulder is also different than hip and knee in another kind of way, because it's a little bit more time sensitive. Because for hips, for example, you can tell the patient you can do the replacement once you really can't walk anymore and once the pain is debilitating. But as you have seen in these models, once we have too much bone loss, once we have too much loss of function and too much atrophy of all the muscles around the shoulder, rehabilitation process is much more difficult for these patients, and also fixation of the components might be more difficult, and you need bone graft and things like that. So that if you prolong the surgery, you might need a much bigger surgery later on. So it is not recommendable in shoulder replacement to wait too long.
I think it's a very valid point. I always tell my patient, patient asks, can I leave it for 6 months or 1 year? Problem is, this bone will get more worn out.
Yeah.
You may not be able to do successful shoulder replacement. So the success depends on suitability of the bone as well for the shoulder replacement. So when it is significant, better get it done rather than waiting.
How many doctors were trained by you after?
Many. Basically, I have been training 2 fellow doctors every 6 months. So I personally trained those who work with me, about 40 orthopedic surgeons across the country. And of the 40, I'm proud to say 32 doctors have come for the conference to just meet and touch base. I absorb technology very quickly. Everything new I want to try, I would like to try. So that's why they keep coming back to me to learn. It's a group learning. It is not individual. It's a group learning. And second, through the society, shoulder elbow society, we train a lot of people. And in this congress is attended by close to 400 orthopedic surgeons altogether, and 100 orthopedic surgeons coming from Chennai, and around 90 to 100 coming from rest of Tamil Nadu, and 40 around from Andhra, Karnataka, and 35 from Kerala, and around 40-50 from rest of India, even from Kashmir. So that tells you the importance. I'm very happy to have a full crowd at morning 8 o'clock on today. That's normally we don't expect in a congress, but it was there. That is because every orthopedic surgeon is treating shoulder problem, elbow problem, hand problem. Some cases are complex, but in our society, say in UK, I was a dedicated shoulder upper limb surgeon. We practice with about 18 consultants. So we have a hip guy, we have a shoulder, we have an elbow, we have a knee. So the patients will come, anything treatable by general orthopedic surgeons, they treat. But if it is complex, it go to the specialist. But this lining is not very much evident in India. So that is why we have to teach the general orthopedic surgeon how to be safe. You also learn. The ultimate aim for me is that patients should do better. Not mine, other patients also. Because in my practice, I do 50% revision work. That means the patient had a shoulder surgery, fracture, plating, cuff repair, something done, failed. Or the patient operated for elbow, fractured, stiff, he can't move like this. And the hand, something done, not good. So like this patient, revision we call, I am doing 50%. Now, well, of course I can treat them, I can make them better, pain-free, but think about the plight of the patient and the family. In India, every operation is cost. So you have time. So they have to have one operation. It fails. Our people will be very reluctant to come for revision. In UK, Europe is not a problem because the NHS covers, they also go, but here it's not like that. So we don't want that patients to suffer. So we say, okay, general orthopedic surgeons or trainees, you also better get equipped with the knowledge. At the same time, you should be aware of your limitation because you don't want to do everything. You want to refer some cases to the specialist. Ultimately, for the patients with the shoulder, elbow, hand problem to do better.
Any side effects, sir? Any side effects?
No side effects.
How soon the patient can get into normal life than the conventional one?
See, I think that's sometimes misconception. Sometimes we don't have the reverse shoulder model. I don't think we have reverse shoulder model. See, when we say patient reverse shoulder, they will think, oh, something is reversing. Wrong. It's not like that. Shoulder is the only joint where the ball and socket mechanism is not working. We make it stabilized by putting a ball on the top side and socket on the bottom side. It will work literally like a normal shoulder. You will not be able to differentiate between a normal shoulder and a reverse shoulder. The patient will be able to do lift up fully, reach hand and reach behind. Everything can be done, lead a normal life.
How many hours to take an operation? Hours and recovery period?
Operation usually takes about 1 to 2 hours maximum, and the patient usually stays in the hospital 3 to 4 days. It is depending on the patient's complexity. If the patient has multiple medical problems, they tend to stay a little bit long, but average is 3 to 5 days. And in my practice, I do not put them in a bandage or a sling or plaster. I let them take shower the next day and I leave them arm free to move it. The patient can start moving assisted forward movement, hand movement, elbow movement, shoulder shrug, roll, all these movements they can start. The problem of putting the patient in a sling or a bandage means they develop stiffness. What is the point of fighting with the stiffness to have rehab and in other situation where you can avoid it preemptively? So that's my plan. And in 1 month they will do this exercise. The second month they will do full range of movement. Okay. Third month they will do muscle strengthening with the TheraBand. So I will tell my patient after shoulder replacement, for you to lift up like this, it will be 3 months. The very first month you need some support. ladies, household work, lot of things are there. I will tell them, you need support for 1 month, first month. Because we operate like many patients, elderly patients who are here, son and children, doctors. Actually, my practice, 1/3 of my patients are doctors. I operate on, referred from elsewhere. So they might be abroad and their elderly parents are here. That's a very common situation. We have a supportive team for that, a 12-member team to take care of that as well.